Wellness Warriors. Welcome to the Burnout Resolution Podcast. I'm your host, Dr. Mylaine Riobe, and today we're going to tackle the hidden links between anxiety, panic attacks, and burnout from a Western and Eastern perspective. So let's talk about what's really happening when anxiety and panic attacks take over. Most people think it's just stress or some temporary chemical imbalance in the brain, but anxiety is actually an early warning sign that something's off. When ignored, these loud whispers turn into screams: anxiety, panic attacks, depression, fatigue, digestive issues, and more. In a nutshell, this is what burnout looks like. These can even evolve into autoimmune conditions and more. While most people don't relate their anxiety to other conditions that come as a result of the untreated anxiety, what they don't realize is that they're going down this slippery slope. And even if they're using anxiety medications or antidepressants, because the root cause of the anxiety isn't being taken care of, these conditions can still crop up. And these same people end up on more and more medications, seeing more and more physicians, trying to get to the root of 10 other things that come as a result of the anxiety, when really what we should be doing as a medical community is looking at the root of the anxiety itself, not just masking it with medications. In integrative medicine, anxiety isn't just a mental health issue. It's a metabolic issue. It tells us that there's a mismatch of metabolism, a mismatch between supply and demand, the supply of energy that your metabolism can give versus the demands of what our modern lifestyles are asking of us. Anxiety and panic attacks are rooted in an overstimulated nervous system when we're stuck in fight or flight. That switch being turned on constantly to fight or flight wears out certain neurotransmitters in our nervous system: serotonin, GABA, dopamine, and shifts in adrenaline like epinephrine, norepinephrine, and of course, cortisol, our chronic stress hormone. But these aren't the actual root causes of the anxiety. They're symptoms and signs of something deeper that's going on in the body. So when we try to just balance neurotransmitters as a resolution of the anxiety and panic attacks, what we're doing is we're actually masking the symptom. While that's sometimes extremely important because panic attacks are extremely distressful, we also need to look underneath the surface at the actual root cause of what's causing the panic attack and the anxiety from a physiological level, as well as from an emotional level or from a level of past trauma. So of course, this is where therapy comes in. However, the physiological changes often go unnoted and unexamined. And this is why people get stuck without answers. So what happens is they get put on these medications, they feel better, they don't have the anxiety and the panic attacks anymore, but then they're still going down that slippery slope of burnout. And they may have side effects to the very medications that are helping them. These same neurotransmitters that are being imbalanced, that are leading to the symptom of anxiety and panic attacks, are also deeply dysregulating metabolism at the same time. So we get dysfunction of the mitochondria, which are our energy powerhouses that make our usable energy that our body so desperately needs to meet the demands of our modern day lifestyles. It's also imbalancing blood sugar regulation, other very important hormones such as estrogen, testosterone, progesterone, DHEA, insulin, and more. This leads to other things such as immune system dysfunction, gastrointestinal dysfunction, detoxification dysfunction. And this is where people get trapped. The thing is, it's not the anxiety itself that creates these underlying issues that are going on. It's those underlying issues that create the anxiety. And then they feed off each other, creating this vicious circle, this chicken and egg game where you don't know which came first, and it makes things look extremely chaotic on the surface. The issue is that very often these types of imbalances are under the radar, under the surface. They're not making themselves obviously known. And so when we go to the doctor and we tell the doctor that we're not feeling well, we have a little anxiety, we're a little tired, we're not sleeping well, we run the usual tests and they usually come back normal. And so we keep telling you that everything is okay when it's not. And this allows these things to fester and continue to erode our metabolism and function, making the anxiety even worse and potentially leading to the panic attacks later. So when your body's already teetering on the edge, anxiety is actually a very early warning sign that something much deeper is going on metabolically that will not show up in your blood work or in most other tests that we do from a Western perspective or a conventional medical perspective. You might get CAT scans, you might get referred to a neurologist, a psychiatrist, an endocrinologist, but not really find any causes per se. And the longer these causes go unaddressed, the more likely you are to spiral into burnout or even potentially depression or other mood disorders. From a Chinese medicine perspective, there are distinct patterns that underlie the anxiety that help us to know what is going on internally that our blood work can't show us yet. And that's the beauty of traditional Chinese medicine. And in fact, those patterns exist even years before the symptoms occur. And this is what makes traditional Chinese medicine preventive. So if we can identify these patterns, even when someone is feeling well, we could potentially prevent symptoms and conditions from occurring over time. Science is starting to show us this as well. We're beginning to understand that when we do cellular level testing, in other words, not looking just at the blood work, but looking deeper at the levels of your cells where the imbalances occur that lead to the symptoms, we can often see abnormalities years and years before the onset of the actual symptoms. And so it's not the symptom that should guide us to go looking. There should be a preventive emphasis where we're looking deep into the cells of the body, even when you're well, long before you have symptoms, so that we can make those corrections when they're more minor and help you prevent things from cropping up unexpectedly as you go along. The interesting thing about anxiety and panic attacks is that they can be due to having depletions in metabolism or excess energy in the form of inflammation and toxins or stuck energy due to stress. So anxiety can be due to stress stagnating the flow of energy or qi, as it's called in TCM, creating the sensation of feeling anxious. The liver is actually the mother of the heart. And so very often anxiety will present with palpitations or the sensation of rapid heartbeat. This can actually wear out the energy of the heart, so to speak, and we can see a pattern develop called heart yin deficiency as well, which often underlies the symptom of anxiety. This can also wear out spleen qi. Spleen qi is roughly the equivalent of what we might call metabolism. So our body's ability to make and use energy is roughly the equivalent of spleen in traditional Chinese medicine. Although there's no direct equivalent, we can't really say that spleen is metabolism because in traditional Chinese medicine, we're talking about energy, not necessarily physical structures. But if we really dive deep into the field of quantum physics, we'll see that actually there is no such thing as a physical structure. Albert Einstein said over 100 years ago now that there is really no such thing as matter. And that matter is simply very low vibrating energy that's vibrating at such a low frequency that we can perceive it with our senses. And so ultimately, everything is, in fact, energy. And so this is why traditional Chinese medicine works extremely well, no matter what we're dealing with, no matter where in time it finds itself. There aren't really any medical studies that have been done or scientific studies that have been done that have debunked traditional Chinese medicine. In fact, we have more and more corroborating science to validate TCM, which is in sharp contrast to our own conventional medical model, where we have studies that show that the majority of our medical studies in Western medicine are actually reversed within 3 years of publication. So I've learned over the years to trust traditional Chinese medicine. They've been around for about 4,000 years, and the more we examine it, the more accurate we find it to be. And so using traditional Chinese medicine to diagnose the symptom of anxiety or the condition of anxiety is extremely useful because we can then tell if your anxiety is coming from a place of being depleted or a place of having stuck or excessive energy. And that's a roadmap to help heal that anxiety over time. We can use traditional Chinese herbs, acupuncture. We can dive deep into the cells of the body as well. That doesn't involve traditional Chinese medicine specifically. That's more functional medicine or integrative medicine. So traditional Chinese medicine really doesn't have any tests associated with it because it's 4,000 years old and there were no tests back then. But functional which is a more holistic version of our Western medical model, does include a ton of testing. Now, within functional medicine, you'll see that there are two branches of functional medicine. There will be the physicians that still follow more or less our conventional medical model where they do a lot of blood work, upwards of 150 different blood tests, which they then use to prescribe supplements and help heal the symptoms. Then there is the camp that is like me, where we tend to do more cellular-based testing or metabolic testing. I've come to realize over the years that blood work just isn't where we need to look for the vast majority of what we're looking for in terms of explaining why someone has a condition or preventing a condition. The bloodstream is a very protected environment, as you've probably heard me say many, many times if you've listened to my podcasts in the past. Your bloodstream is very protected because it feeds your heart and lungs. So when we look at blood work, we're looking at a very protected environment. Symptoms usually occur from cells in your body that are not protected, that are less important for your survival, like hair follicles, immune cells, gastrointestinal cells, or even liver cells, skin cells. These are places where your body will not send as many nutrients to if it's perceiving itself to be in some kind of distress. When the body feels that it's in fight or flight responses, when there's chronic stress present, it shunts everything to the heart and lungs, and it starts to deplete or suppress other areas of your body it doesn't deem important for fight or flight reaction. And so those cells get kind of shortchanged, right? If we're running away from a lion, a tiger, or a bear, we don't need to detox, we don't need to digest, we don't need to reproduce, we don't need to fight off infection. We just need to run, right? And so those systems get suppressed. They don't get as much energy to them. And this is where they begin to malfunction. Now, your body will, again, protect blood flow, raises your blood pressure, raises your heart rate to make sure that it can get everything to your heart and lungs that it needs to. Now, your muscles that you use to run don't actually use oxygen in fight or flight. So your body doesn't send a lot of blood flow to the musculoskeletal system when it deems itself to be in fight or flight or it thinks it's under threat, which is counterintuitive. A lot of people think, well, my musculoskeletal system should be getting a lot of blood if I'm supposed to be running. But remember that those sprinting muscles don't use oxygen, so they're anaerobic muscles. And so, yes, your musculoskeletal system is right there with your skin cells and your hair follicles at the bottom of the food chain. So if we want to know why someone has symptoms, we have to look at those cells being shortchanged. If we keep looking in the environment that's protected for fight or flight, we're not going to find the answers. And this is why, even when we do 150 different blood tests, they all come back a little bit off, a little bit not specific, but nothing in detail. However, if we test, for example, the immune cells, we're going to get a whole different set of answers than if we test the bloodstream. And in fact, I see that all the time with my clients in my private practice. They'll come back with normal blood work, and then we'll do testing on their immune cells, and we see how all hell has broken loose inside of them. They'll have a ton of vitamin and mineral deficiencies, their immune system scores will be low, their antioxidant scores will be low, and this explains a lot of the inflammation and fatigue that they have and other cellular malfunctions. The reason the immune cell is a great place to look is because it's kind of in the middle of the food chain when your body thinks it's under distress. So your immune cells they're definitely not as important as your heart and lungs, but they're also not as unimportant as a hair follicle. So it's a great place to look for average values of things that are available to your body for use. So when we do cellular-based testing, we get to see where your body is struggling and why it's sending out the signals that you're interpreting as anxiety or fatigue or insomnia or whatever the case might be. The same goes for things like hormone testing and looking for detoxification, for example. To know if your body's not detoxing properly, we want to check your urine to see what byproducts of detoxification are being sent out of your body to make sure that they're falling into the right categories. And this is how we can tell if you have a detoxification issue. We will never see that with your blood work. Your liver function will always look normal in your bloodstream. And even when it's not normal, it usually goes out of balance for a little bit and it comes back to normal, even though you're still not detoxing properly. I firmly believe in cellular-based testing for that reason. And we have a lot of studies starting to emerge to suggest that yes, we can look inside of cells and we will see dysfunction, we will see things that are off, sometimes years before someone even has a symptom. And definitely by the time they have a symptom, we will definitely see within the cellular environment what is creating that. And that gives us solid ground to reverse those symptoms by correcting what we see in the cell. Because it's in the cells that those symptoms originate, right? Symptoms are purposeful. It's your body's signal to you that something's off. You may feel fatigued because you have 10, 11, or 12 vitamin and mineral deficiencies, for example, because of a gastrointestinal issue. But you could potentially have a colonoscopy and an upper endoscopy and a CAT scan of the abdomen that doesn't show anything to be wrong. And you could potentially also have very normal blood work despite having 10, 11, 12 vitamin deficiencies. And you won't know that if you don't test the immune cells for those vitamins and minerals. This is what I believe is the solution to correcting the root causes of anxiety and panic attacks. Very often, again, when we look at hormones from that perspective, we're going to see a completely different world than when we look at hormones through the lens of blood work. Adrenal issues particularly are challenging with blood work. We almost never see abnormalities of the adrenal system in our blood work. So we almost never see abnormal cortisol, for example. We almost never see abnormal DHEA. We certainly can't capture adrenaline, norepinephrine and epinephrine in the blood work. They're too fleeting, they won't show up. But we will very often see with saliva testing or urine testing that the adrenal system is off, which makes sense, right? Because if you are under chronic stress, something has to be going on in the adrenal system because that is the very system that takes over and runs the fight or flight responses. So to have normal blood work in a circumstance where you're under chronic stress doesn't even make any sense. And so we have to look inside of the cells to know that. And the gold standard for adrenal dysfunction is to use saliva testing. And again, we do have studies emerging to show that saliva testing should be the gold standard to look at the adrenal system. Now, again, we have to discuss the idea that blood work does show certain adrenal abnormalities. So there are two severe adrenal conditions that will show up in your blood work. One is Addison's disease, which is a complete failure of the adrenal system to function. And the other is the other extreme, where there are usually tumors in the adrenals that are producing too much cortisol. We call that Cushing syndrome. So those are very extreme conditions on opposite sides of the spectrum of the adrenal system. They affect generally 1% of the population or less. That will show up in your blood work, but nothing else will show up as abnormal. So in order to find things that are not quite that extreme, we understand in integrative medicine that there is a condition called adrenal fatigue that is not recognized by Western medicine or by endocrinologists. But it's when inside your cells, especially the cells that are being shortchanged and suppressed by chronic stress, they don't quite get as much cortisol as they need. They don't quite get as much DHEA as they need. We call that adrenal fatigue. When we test the cells, we'll see that the levels of those two hormones might be low, or what we call deceptively normal. So there is such a thing as normal cortisol not being normal, right? So if you are under chronic stress and your cortisol is normal inside your cells, that's not normal, right? We should see an appropriate response. So if you're under stress, we should see high cortisol in your cells, right? So that it matches. Then we can work on getting those cells to normalize the cortisol because we're supporting them. When we see normal cortisol in someone who's not taking adaptogens or anything to support the adrenal system, and they're under a lot of stress, we know that there's a mismatch there, right? Your adrenals are not making enough cortisol to support, so the cortisol looks normal. So those people generally don't feel well, and we'll almost always see that their DHEA is low inside their cells. That's one of the earliest pictures of adrenal fatigue, is when the DHEA inside your cells is low. Again, it's not common that we'll see low DHEA in the bloodstream, but we will see it within the cells. So you have to get your test interpreted by someone who understands how to interpret cellular-based hormones in order to get an accurate interpretation and treatment. There are other levels of adrenal disorders. So there is adrenal stress, where your DHEA is normal, but your cortisol is too high. And there are a whole separate adaptogens, and they're treated differently. So when you have adrenal fatigue, there are certain supplements that will help that. When you have adrenal stress, there are different supplements to prescribe that will help that. So that's where ashwagandha, rhodiola come in. Whereas when you have adrenal fatigue, that may involve replacing the DHEA with bioidentical DHEA, as well as using potentially adrenal extracts or licorice root or a combination of those things, depending on what your results actually show. Getting the adrenal system to function more optimally is extremely important for controlling the root symptoms, the root causes of anxiety and panic attacks. Sleep is also extremely important, and sleeping for your dynamic metabolic type is very useful. And again, if you're having trouble sleeping, we did a podcast on sleep just a week or two ago, so I encourage you to go and take a look at that to give you some solid tips on how to improve your sleep. Looking at the gastrointestinal system is also extremely important if you have anxiety and panic attacks. Very often, the chronic stress also leads to a gastrointestinal issue, which is what throws off those neurotransmitters that affect your brain. And so looking at the gut with functional testing is extremely important. Again, if you get a stool analysis at a regular lab, you're not going to see this. And the colonoscopies, the CAT scans, and the endoscopies just don't show things, or they'll show very non-specific things like gastritis and other like inflammatory things, but not really have a conclusive diagnosis. And again, if you do have anxiety and panic attacks, make sure that you get tested for SIBO, which is small intestinal bacterial overgrowth. Make sure that you get a breath test to look at that. Those breath tests can be deceptively inaccurate, so make sure that you're seeing an integrative medical doctor who has a lot of experience in interpreting SIBO breath tests. And sometimes it does need to be combined with a functional stool analysis to get the whole picture. And then, of course, we come back to my favorite, breath work. So HeartMath quick coherence technique has been extensively studied for anxiety and panic attacks and shown to be extremely valuable. Remember that how you breathe actually directly signals your brain to tell it whether or not you're safe. And so HeartMath quick coherence technique has been shown to help your brain understand itself to be safe, to turn off the fight or flight switch, to give your body a break. When your body gets a break, it gets to restore itself. Anxiety and panic attacks are when the body is trapped in that fight or flight mode, or so worn out that it can't get itself out of the fight or flight mode because it's too worn out to do that. When your body thinks it's under distress, if it's depleted, there's an infection that it can't treat by itself, there's an accumulation of toxins and inflammation, for example, subconsciously it turns on the fight or flight system as a warning that something is wrong. And that creates shallow breathing. We just won't even know we're breathing that way if we're not consciously interrupting how we breathe. And so this will set us up to be shallow breathing. That shallow breathing keeps you stuck in the fight or flight loop. Again, you get to consciously break that pattern if you do the HeartMath quick coherence technique 3 times a day. What you're looking to do is to raise your heart rate variability. People with high heart rate variability don't have anxiety and panic attacks. And that's something that you can train your body into with consistent practice. So in our Wellness Warrior 9-week transformation program, we dive deep into what I call dynamic metabolic typing so that you can apply your dynamic metabolic type to the 4 pillars of wellness so that you can get yourself out of the cycle of burnout. Anxiety and panic attacks are a sign of burnout that can be very successfully and quickly treated with the right approach. So remember, you're not broken. You're just living on modern planet Earth. The anxiety and panic attacks that you may be experiencing are a compass. It's a hidden language that your body is speaking to you to help you find your way back to balance. So if you're experiencing anxiety and panic attacks, take it seriously, of course, but not fearfully. It's an invitation to heal, and you don't have to do it alone. If you'd like to know more about our Wellness Warrior 9-week transformation program, I invite you to visit our website, awakenedwellnessnow.com. If you'd like to participate in our 7-day challenge, check out our website and you can enroll for our next one. That'll give you a little glimpse into our 9-week transformation program, and we've had participants have amazing results in just a few days as a glimpse into what is possible. If today's episode resonated with you, please share it with someone you love that you feel might benefit from it. Please also like and subscribe to our channel. And if you'd like to know more about our corporate programs, visit our website where you can also take our corporate burnout risk assessment and get customized tips for your business to get your team out of burnout with sustainable and lasting results. So as always, thank you for watching, and until next time, many, many blessings.